Hey, you know, it's Hospital Week nationally. Woohoo! And here in the Commonwealth of Virginia, to celebrate, well, what are we doing? What do you do in hospital? How do you celebrate it? Like, do you have a party? No! You do your syndicated radio show right from the offices of the Virginia Hospital and Healthcare Association. That's how you celebrate. And you get their Vice President of Communications, Julian Walker, to bring bagels, coffee, and donuts. Wawa coffee. Not just any coffee. Wawa coffee, my favorite. So that's how you celebrate. That's how we're celebrating today at the offices of Virginia Hospital and Healthcare Association in Richmond. Always good to be here. And you know that Virginia hospitals, they're open 24/7, 365. That means like all the time around the clock to provide healthcare access to peeps in need, like our family has had to do. And they're also the economic cornerstone. They're the pillar. They're the capstone of many of our communities. Now, a few facts about Virginia's hospitals. They provide essential health care services to people in need. They're committed to working collaboratively to achieve top-tier health care safety, quality, value, and service en route to making Virginia the healthiest state in the nation. Like me, I'm pretty healthy. So I don't eat any bad stuff. I eat good stuff. I just eat too much good stuff. Plus, I just ate this bagel with cream cheese. That probably was not the healthiest thing I could eat. But I'll blame Julian Walker for that. It was good, though. Now, they've handled 3.6 million emergency room visits, accommodated nearly 800,000 inpatients, and delivered more than, get this, 95,000 little tykes babies in 2015. They provide 125,600 good-paying jobs. Good-paying jobs, that's a lot of jobs. As Terry McAuliffe would say, them's a lot of jobs. Governor McGenius. And they have a payroll of $8.5 billion and contributed $38 billion to the state's economy in 2015. Now, I know you're dying on the edge of your seat for more information. Well, here's what you do. You go to VHHA.com, VHHA.com, or you can go to ISupportVirginiaHospitals.com, ISupportVirginiaHospitals.com to learn more. Now, joining us now, he knows a little bit about hospitals because he's the president and CEO of the Virginia Hospital and Healthcare Association, former political figure, former high-ranking official in the Bob McDonnell gubernatorial administration here in Virginia, and now running the VHHA Association. And he's with us now on the line live from Washington, D.C. Normally I'm in D.C., but now I'm in Richmond. He's in D.C., but now he's with us. Sean Connaughton, good to have you with us, Sean.
Good morning, John. Happy Hospital Week.
I know it's kind of festive, right? It's festive. It's kind of. I'm excited about Hospital Week.
Yeah, I know. It's
I'm here
an
in
exciting
Richmond.
time. You think about, in every community across this great Commonwealth, there are great hospitals and great healthcare systems and facilities, and every one of us knows someone who works in healthcare. And so this is the week, I think, we'd like to see people recognize the important contribution and great work that all the people in the hospital and healthcare community provide to Virginians. Like you said, 365 days a year, 7 days a week, 24 hours a day. They're always there for us.
Yeah, and they also provide all these good-paying jobs. They'd even make Terry McAuliffe blush, and benefits $8.5 billion.
We'll leave that one alone.
I just got this text here from George at Newport News. George says, John, just for the record, you had 7 hot dogs at shad planking. That's not the epitome of healthy. Well, let me explain that. I washed it down with shad roe, which if you've ever eaten the fish eggs, shad roe, it's a grotesque thing. But you eat the shad roe, and that like destroys everything. Everything in your stomach, it just destroys it all. So you're kind of even with that. But I did have a lot of the Frank Wagner hot dogs, now probably the healthiest thing I ever had. But they were good. Now, Sean, I don't want to get into too much policy, but let's just start with this. I'm against any changes to COPN. Am I right? You know I am, right?
Yeah, well, I mean, we'd love to see the system improved. We've always said that. Our challenge with what's happening in Virginia and across the country, we're all facing the same thing, is the market, the healthcare market, has just completely been turned upside down over the last 7 years. due to the Affordable Care Act, or also known as Obamacare. And now, we're essentially going in a completely different direction right now, and we're not quite sure what's going to be happening in Washington. That's one of the reasons I'm up here today and trying to work with our delegation and other states and other healthcare providers to try to figure out, how do we get Congress to focus on, making the current law better? How do we make it so that we deal with coverage, we deal with access, we deal with quality and costs? And so COPN right now in Virginia and in the majority of states across the country is one way to deal with some of the current inequities in the healthcare system, particularly from the fact that, as you know very well, hospitals have to, and they want to, but they have to provide health care to anyone walking in the door. And that means that many of us who have health care insurance, we obviously can pay for it, but very large numbers of Virginians can't and or are underinsured. And so COPN is one way to deal with access issues, and it's another way to make sure that we do ensure that communities throughout the Commonwealth have some of the basic services that are needed, particularly in emergencies, for their citizens. So we'd like to see some improvements in the system. We've always said that. We support that. But just simply deregulating and thinking that's going to improve things or lower costs is just simply not going to happen.
All right, so Sean Connaughton, you're the CEO and the president of the Virginia Hospital and Healthcare Association. You're in Washington, D.C. right now. Obviously, now the debate on Obamacare, what happens to it, Trump care, whatever you want to term it, moves to the U.S. Senate. That's why you're there. Talking to some of the professionals today and some of the politicians, some staff, how do they see this thing playing out, Sean?
Oh, that's a great question. And anyone who tells you they know what's going to happen is lying. Because this thing has sort of taken a life of its own. It's a very complicated issue. I think one of the biggest challenges we have is that, healthcare is complicated, and it is very difficult to get your arms around. And, some of the basic challenges that people are facing is insurance and the increasing cost of insurance and the changing, essentially, scope of coverage of insurance. At the same time, we're dealing with a lot of changes to what the actual providers, people providing the services, and some of the challenges there, whether financial or how they are dealing with delivery system reforms. All that being said, what the House just passed is, create some unique new challenges for all of us. We're not quite sure what the Senate is going to do. They have criticized the bill that just got passed by the House, many of the Senate members. And so we expect to see some fairly dramatic changes there. Our biggest thing is, they're doing things like with Medicaid, and I think everyone in Virginia knows that, we have a very, very stringent Medicaid program. In fact, we're 47th in the country, 47 out of 50, on Medicaid and how much we spend on Medicaid per capita. And, they're looking at doing block grants, which has the potential to, lock us into 47th forever. We are looking at, the fact that, block grants particularly end up passing the entire risk onto the states. And so what does that all mean for us? And then for us, we continue to have these what they call Medicare cuts. And these are actually reimbursement for services provided to senior citizens. And now we're down 88 cents on the dollar. Essentially, when you look at it, we're sort of like government contractors in that we're providing services to people covered by the federal insurance program, but we're only getting 88 cents back on the dollar for the actual cost of providing care. And those numbers are going to increase, or I should say the reimbursement is going to decrease over time. So we're up here just trying to work with them, make them aware of the current challenges, that they need to address the current challenges instead of creating new ones. And that's unfortunately, given the politics involved and the vehicles that they're using, it's a tough slog.
All right, Sean, so when you mentioned about the block grants, and I've been saying this on the air now for several days, it's one of the reasons I changed my position on Medicaid expansion, because if you look at the environment we're in right now, and so that everybody knows what is going to happen here, Virginia is number 47 in Medicaid rates and paying doctors. That means that there's only 3 states that pay doctors a lower number than Virginia does. So I want everybody to understand what this means. So because we didn't take the money for Medicaid expansion, and I fought it for 3 years, I thought we did the right thing, but now I think it's different because it's all played out and everybody's getting the money but Virginia. But the bottom line is, if they block grant it, so if you're Ohio and you expanded Medicaid, you're going to get that funded in perpetuity, right? Because here's what's going to happen.
Yep.
The Republican senator in Ohio, right, which they absolutely need to pass the bill, and same with the other Republican senators in red states that expanded are saying, there's no way that I'm going to vote for this if my state doesn't get the funding here for Medicaid expansion perpetuity. So in order to pass it, they're going to have that. Now, if you didn't pass it like us and you have no Republican senators with no leverage, that's reality. This is political reality. Sean, tell me if I'm wrong. So we have no Republican senators with any leverage in Virginia. Kaine and Warner are going to vote no matter what it is. They're going to vote no. So now what they say is, okay, well, we're going to block grant Virginia. That means they're going to take what we're paying now, which is the third lowest amount, and you block grant that in perpetuity. So you get the lowest amount except for 3 other states for eternity if we don't do something to change it. That's what's going to happen if this goes down. Am I right?
Yeah, and listen, John, that's exactly. I mean, that's the point we've been making. They're going, and we just had a meeting of all my counterparts in the 19 states that did not expand Medicaid, and we're all in the same position. I mean, so if you just step back from a political standpoint, and I'm not saying this from a healthcare provider standpoint, from a political standpoint, the 19 states are primarily red states, and they did not support expanding Medicaid. And now, as they go in there and they do these changes to the Affordable Care Act, Obamacare, they are essentially going to the Republican Congress and the Republican president have the potential to end up, quote unquote, providing these additional monies to the blue states that expanded Medicaid, and the red states that didn't are the ones who are essentially going to be locked out of this program and locked out of this additional money. And when we say that, it's not just simply an entitlement, and I think everyone in your audience has to understand, is that we're talking about reimbursements for services performed. And right now, about 7% of the patients showing up to Virginia's hospitals are free. They're indigent. These are, in every state that has expanded Medicaid, seen a dramatic decrease in those essentially uninsured people coming in to get care. Now, why is that important? Because we all know that if you got 7% of your patients, and some hospitals it's even higher, that means to cover the costs of services, you're going to have to do some cost shifting to remain viable. And so, long-winded way of saying, I mean, this is what we've been trying to get through to, particularly the Republicans in the Congress, that if they keep on going down this path, they're actually going to hurt the very states that ended up supporting them on issues involving Obama and Obamacare. It's crazy time.
Okay, so here's the deal. By not expanding Medicaid right now, and forget the past is the past because I was opposed to it because I didn't know what was going to happen, and I didn't want Virginia stuck holding it back. But now we have the trifecta of pain. Let me explain what it is. Number one, right? We've already given up $11 billion that would have come to the state that ends up going somewhere else. It didn't go back to the federal treasury, okay? It didn't reduce the deficit. It just went to somebody else, right? That's number one. Number two, okay, because we didn't expand, and again, we have no Republican senators, and we have no leverage. We're going to get, if this goes through, we're going to get block granted by the federal government for the Medicaid that we have, right, which is federal law. We're going to get block granted under the 47th lowest payout percentile. I want everybody to get what this means. If you're a doctor in Ohio or Pennsylvania and you accept Medicaid, you get a higher reimbursement for the same service, exact same thing, than you do in Virginia. So what does that mean? There's no way to increase it because you're block granted. So what happens is you're going to have a tough time getting doctors in Virginia. This is just, hey, everybody believes in the free market. This is free market reality. Here it is. Number 3, okay? That then drives up the number of indigent care people with no insurance and no ability to pay who come into the emergency room or go to the hospital and can't pay. 7% now, that number goes up. Well, hospitals can't lose money because there's no way to fund that. So what happens is prices go up. Doctors go down. Prices go up because you have the indigent care, all right? So you're paying more regardless if you're in Virginia. And then just to add icing to the trifecta of pain disaster is you're locked into this in perpetuity with no way out. That's what's going to happen. I mean, and the math is there, right? Facts don't lie. That's where we are right now.
And this is one of the things we point out. Listen, Congress has not shown, Republican or Democratic Congresses have never shown, a great deal of backbone when these deadlines for cutting programs come up. And so in the bill that passed the House, they end up having that Medicaid expansion will be essentially eliminated in 2019. We know it's going to happen. We're going to get to 2019, and they're going to, kick the can down the road. Again, creating even more challenges for us and never really addressing what we think are the important issues, and that is, quality, access, and cost. And John, I think this, when you look at the size of the federal footprint in healthcare, whether it's Medicaid or Medicare or some of the several other programs that the federal government end up supporting, this is again an extremely complicated, industry, extremely complicated, whether insurance and provision of care. And I'm sorry, you can't run essentially 1/10 or 1/9 of the U.S. economy with a board of directors of 535, which is how many members there are in Congress. They can't focus on these issues. They can't, they can't deal with the details and the technical side of it. And it does make you say, should we start to address this in a whole new different framework? Because continuing to try and deal with, and listen, we've been met with numerous members of Congress on this issue, and it's hard for them to get their arms around. A lot of it, I'm not blaming them because it is so difficult of an issue, and I think the federal government has step by step become more and more involved in it. But, we got to do it a different way, and we got to get them all to start talking and stop playing politics. I know this is kind of crazy I'm going to say a reform politician here, but, this is important stuff. It impacts everyone in Virginia and in the United States, and we've got to get them to focus on dealing with the challenges in healthcare on access, quality, and cost.
I tell you what, Sean Connaughton, you're so right. And just update here so everybody knows, before I forget, I want to thank you for hosting me today during Hospital Week, and I'm always excited to come up to your place and hobnob with all your great people here. And Julian Walker had to get up at 3 a.m. or something to come and let me in. He's not a happy camper, but he came in. He was sprightly, though. Came in all bright-eyed and bushy-tailed, and he did get Wawa coffee. You bring me Wawa coffee at 5 a.m. There's a special place in my heart for you, Sean. So I want to thank Julian for that. Okay, you got a minute. What's your closing message here, Sean Connaughton, on Hospital Week?
Well, first, I just want to ask everyone. We realize that hospitals and healthcare workers are there for us each and every day, and I just encourage everyone to thank them. They do incredible work, difficult circumstances, and they're always there for us. So I really do encourage people to think about this week and to, if they know someone, a doctor, a nurse, we all know somebody out there who's involved in healthcare. Thank them for what they do because it is an essential job and an essential function for us and our families. You know, it's amazing when you think about that 3.6 million visits, emergency room visits a year. John, think about it, there's 8.3 million Virginians. So you're looking about 40% of the population visits an emergency room every year. I mean, just that number alone is staggering.
That's a huge number, right?
People to engage in this debate. Go to isupportvirginiahospitals.com, our website. Go to our website. Sign up, get involved, because what's happening in Washington, what happens in Richmond when it comes to health care impacts each and every one of us and our families, and it's way too important just to leave it to, honestly, the politicians and special interest groups.
All right, that's it. Out of time. I want to thank Sean Connaughton for being with us. Hey, more information, isupportvirginiahospitals.com. Go to isupportvirginiahospitals.com or VHHA.com. Visit them both. Sean, as always, thanks for having me. Thanks for being such a wonderful host. I'll see you soon, and you have a great day.